We've all heard it. Maybe we've said it ourselves. I never thought it would happen to me. All too often, that's the mindset when it comes to health insurance coverage and a serious illness. But what if you needed a life-altering surgery and your insurance was unwilling to cover it? One local woman has that same question. Leah Linscheid is answering it tonight in this Call for Action report.
I'm a Christian. I am very strong in my faith.
It started with head-splitting migraines.
I am a teacher. I love to teach.
Then problems speaking, sometimes using the wrong words in sentences.
Obviously, mom, wife, very important parts of my life.
Memory loss, sometimes forgetting her own children's names.
Is this?
Yeah, it's
These symptoms, life-altering, have changed how Bethany Kelly identifies herself.
Can I have a kiss? It's exhausting.
Thank you.
From a woman of faith, a teacher, a mother, to a patient in never-ending pain.
You don't realize how much energy it takes out of you to be in constant pain all the time.
Bethany's family has been across the country to countless hospitals trying to find a cure. First, they found the source of her pain with help from a Houston doctor.
His diagnosis was a pineal cystic tumor. The longer it stays in there, and the more it grows, the more damage it's doing.
Surgery seemed to be the only option, a procedure this particular doctor has done before, except Bethany's insurance wasn't willing to cover it. She's appealed their decision more than once.
I filed for just the pre-surgery appointment, and it was denied. They said that I could get the same care within the Dean system. I haven't found anybody in the Dean system to help me.
Bethany says no surgeons within Dean's network have been willing to perform the operation. Without it, it's been hard to fulfill the roles that make Bethany Bethany.
I wasn't supposed to eat it? I thought I was.
I have days where I have to cry out to God and say, God, please just take away the anger and take away the pain. Not only physically, but just the emotional pain of going through something that's scary.
One of the biggest challenges is that people don't understand exactly what their coverage is until they need to use it.
If this happened to you, would you even know where to start? For most of us, the answer is no, and that's because most of us don't pick out our own health plan.
We're having other people make those decisions for us, either the government or our employers.
Scott Kowalski is the VP of Marketing at WPS Health Solutions and teaches part-time over at Madison College. He says there are a couple of things we can do to make sure our plans are as comprehensive as possible. Oftentimes, employers will offer 2 or 3 options to choose from, so do your homework.
We research weeks, months before we purchase an auto, before we purchase a car. Yet, we don't do that kind of same research when we purchase health insurance.
Also, do a little bit of digging on yourself.
What is your own history? How do you find yourself right now? Take stock of your lifestyle. So if you're smoking, or if you're a heavy drinker, or you participate in risky behavior like hang gliding and auto racing, those are things that you'd want to consider too.
If you're already in a plan with no chance to change right now, that's no excuse. Scott says be proactive. See what you're covered for, or find a timeline for when you can change your coverage.
Be a student of the game. Understand what you're buying. Understand where your place in the world is at that particular time, and then, get help.
It's sad. I'm 26 years old.
You get one of Daddy?
Not even 30 yet. Bethany's sense of self, who she is, has changed because of her inability to get surgery. She recently had to give up her beloved teaching job because of her symptoms.
Just knowing that I have 3 kids that I could better parent. I have a whole school of children that I love dearly, and not being able to do that, it's sad.
With this Call for Action report, I'm Leah Linscheid for WISC News 3.
Now, Bethany's insurance company, Dean Health Plan, told us its chief medical officer has expedited an independent review of her case to see if surgery is a medical necessity for her, but said it could not share more of the specifics in her case. Meanwhile, Bethany says she now has an appointment with a surgeon at UW Health. Still, should he decide to take on her operation, it would be completely out of pocket for her since UW is not in her network. All right, we look now.